If you've been diagnosed with schizophrenia, one of the best interventions can be cutting out gluten. Many people diagnosed with schizophrenia have a high rate of gluten sensitivity. A lot of people feel really hesitant to believe this because they say, hey, how could I be sensitive to gluten? I'm not having all these gastrointestinal problems. Actually, a lot of people can have celiac disease and gluten sensitivity without having gastrointestinal problems. The other big barrier that I see towards cutting out gluten is that some people have done celiac testing. However, celiac testing doesn't test for all of the allergies associated with gluten. So some people who cut it out, even with negative celiac testing, still experience improvements. Researchers believe that gluten is causing psychotic symptoms in some patients, and that is because of one of its breakdown products called gliadorphin. Gliadorphin is a neuroactive peptide in the body. For some people, it can cause psychiatric symptoms. I've seen many people in my psychiatric practice where I take people off medications who have cut out gluten and have experienced remarkable improvements in their mental health. I would recommend that anyone with a psychotic illness completely cut out gluten for a month just to see how they feel, because the difference can be dramatic. And one last tip on that actually is, if you're going to cut out gluten, cut out oats as well, because even if it says that it's gluten-free, a lot of the times it's prepared in those factories where they process other gluten-containing products, and you get this cross-contamination. And if you're going to do this, you need to do it right, and there needs to be no gluten.